Hello everyone, welcome to Milo. I'm Dr. Sweta Bajaj. I hope I'm audible to you all. So today we are going to talk about breast engorgement. I'm a practicing lactation consultant from Delhi. I hope you all know me very well. So let's see that first of all, what is breast engorgement? So breast engorgement is the swelling tight becomes red, swollen, increase in the size of breast. And usually what are the other signs? We see that the nerves which are crossing across the breast, they get swollen and there is lot of pain to the mother. And what are the basic reasons that breast engorgement happens is due to certain reason the mother is not able to empty her complete breast. It may be because there is poor milk supply or over milk supply, or the mother is holding the breast while breastfeeding the baby. So in case when the baby is breastfeeding and still you are holding your breast after the latch of the baby, then the breast will get engorged. Why? Because there are certain breast lobules which are pressed below your thumb and fingers. If you are holding it in a C shape, you are compressing your own milk ducts. And even if you are holding it in a scissor shape, still there are few ducts which are getting compressed. So the milk outlet from these ducts is not completely out, and hence it will cause breast engorgement. So best and foremost technique to avoid this is that as soon as the baby opens his mouth and is latched completely, you don't have to support your breast or your areola with your fingers. You just have to leave it completely inside baby's mouth. And there are few certain other reasons also that can cause breast engorgement. If the baby is not full or the mother is not well and the mother is not able to empty the breast completely, even then breast engorgement can happen. Sometimes the mother may even have fever and swelling and breasts that feel firm or hard. Now what you can do is you have to make sure that you are emptying your breast completely for every feed of your baby. So first step is that you won't hold your breast once the baby has latched. Secondly, you will make sure that you are emptying your one breast at a time and not confusing the baby and your body as well by switching on to the breast on per one feed only. So per one session of breastfeeding session, you will use one side of your breast completely. Now you might think that you have an infection, but it may even be mastitis or breast engorgement. Few mothers even have hyperlactation, that is they have over milk supply, and that also causes breast engorgement. Now what you can do is you can pump or hand express your breast. Now to pump or hand express, let's talk about hand expression first. You have to gently press your breast so that the engorged milk comes out of the ducts. And what else you can do is you can apply some warm hot compression, give a massage. You can even take a bath. While you are bathing, you have to make sure that your breast is hanging below and the shower is hitting on your back. So on this side of your back, you should get the shower, and while taking the shower, you need to stand like this while taking support from the wall so that your breasts are hanging and there is any engorgement in this area that will get released with the pressure of water, and the warmth of water will also give you a relief in your pain. And in case you're not comfortable in hand expressing, obviously and definitely you should use a pump. A breastfeeding pump is the foremost solution for the go mothers so that there is no pain in hand expressing and there is some milk storage also. And the pumps nowadays are very handy. You can even check it out them on Milo. And you can change the position in which you are lying down and feeding the baby. And you must wear a supporting bra so that there is no ill support, and the pressure of a well fitting bra can help keep the fluid moving in your breast. You must pump to relieve your engorgement. And how can you prevent it? The best way is that you have to frequently feed your baby. In case the baby is sick or the mother is sick and both are not able to feed properly, at that time you can just hand express or pump express your milk. When should you see a doctor? You must definitely consult a lactation consultant or your gynecologist whenever you have a worsening of symptoms like there is lot of redness in the breast, you are feeling chills and fever, you are having vomiting, and you don't find any relief by the home remedies which have been suggested, then you must immediately consult your doctor. देर आर फ्यू क्वेश्चंस. मैम 2 मंथ से लेट्रोजोल टैबलेट ले रही हूँ. इस मंथ लेट्रोजोल टैबलेट का डोज बढ़ाया है. दोनों के रिपोर्ट नॉर्मल हैं. मेरे रिपोर्ट में AMH लेवल बढ़ा हुआ है. क्या प्रेगनेंसी रुक सकती है इस मंथ? मैम डेफिनेटली रुक सकती है. आप अभी टेंशन ना लें, आराम से चलें. शालू चौधरी. मैम मुझे ट्विन प्रेगनेंसी है, 7th मंथ चल रहा है, पेट में दर्द होता है कभी कभी. बेटा 7th मंथ में अगर आप सिंगल बेबी भी कैरी कर रहे हैं तो भी पेट में दर्द कभी कभी होता है. सो सिंस यू आर कैरिंग ट्विन बेबीज, आई वुड रिकमेंड कि आप ज़्यादा घरेलू उपाय ना करें, आप अपने डॉक्टर से संपर्क में रहें. यू मस्ट बी इन टच विद योर गायनोकोलॉजिस्ट एंड टेक हर प्रॉपर गाइडेंस एंड एडवाइस. Should you take a medicine for breast engorgement? On over-the-counter pain medication you can take like Panadol, paracetamol or Crocin, which is easy and handy so that there is no pain which is disturbing you as a mother to look after yourself and your baby. Otherwise there is no pain treatment required. No other thing is required. Basically you need to rest and your body needs to adjust according to the flow of the milk supply which your baby is demanding. So as soon as you as a mother will grow in your journey towards motherhood, your body will understand the requirement and the baby will also understand that how should I proceed to excrete more and more milk from my mother's breast. So the journey will become smoother for you and the baby too. Are there any more questions? You're welcome, Shalu. You please take care and my best wishes for your pregnancy. And for any doubts anytime, you can just tag me on Milo. I'll always be there to help you out. And let me know if there are any questions regarding lactation and birthing. I'll always be there to help you. So let's wind up the session for today. Thank you so much, Milo, for providing a great platform for all the mommies out there and being a connector between the mother and the. Please, can you tell me how can I sleep in bed rest? Can you sleep in bed rest? Shiba, you have to 7 months. If you are 7 months and you are finding it uncomfortable to sleep or lie down, if you have to lie down and you are not able to sleep properly, you can go for a pregnancy pillow or take a longer booster pillow and keep it below your back for a support and try sleeping on a left side position. Ambadas, मैम 3 महीने तक मेरा पीरियड नहीं आता है, ऐसा क्यों? बेटा 3 महीने तक पीरियड नहीं आ रहा है वो तो ठीक है, बट अभी आप ट्राई कर रहे हैं कंसीव करने के लिए या यू हैव जस्ट गिवन बर्थ टू योर बेबी? यू नीड टू टेल मी दैट ऑल्सो. Cervix is short. That's okay that cervix is short. You can easily sleep putting a pillow below your Your back rest is more important since you're 7 months already pregnant and your cervix is also shorter. Then that is why your doctor has also advised you for bed rest. So you need to buy a pregnancy pillow that will really help you, and make sure that you lie down completely and follow your doctor. You're welcome. See, the pregnancy pillow will support your back, your belly, your hips, shoulders, legs also. And sometimes at the same time, your baby body will grow and the changes during pregnancy will also get shaped according to it. So it's a good thing in which you can invest and give a more better and comfortable journey towards yourself. अशोक कुमार मैम, मुझे 3 दिन के लिए सिफ्रिन टैबलेट दिया है, क्या इसे ले सकते हैं? हाँ, ये है, ये किसके लिए है? अशोक कुमार, आप पहले तो मुझे ये बताइए, आप कंसीव करने के लिए ट्राई कर रहे हैं ना? आप अपने डॉक्टर से फॉलो करके ये दवाई लीजिए. दिस इज़ नॉट अ प्लेटफॉर्म टू डिस्कस अबाउट विच मेडिसिन इज़ फॉर वॉट. जो आपको दवाई डॉक्टर ने लिख के दी है वो आपको डॉक्टर ही बताएगा कि उसके बारे में आपने क्या करना है. ये फीमेल इनफर्टिलिटी की मेडिसिन है, ये देते हैं जब कंसीव करने के लिए आप ट्राई कर रहे हैं. हाँ, आप कंसीव करने के लिए ट्राई कर रहे हैं, उसके लिए आपको ठीक मेडिसिन दी है. यू शुड टेक द मेडिसिन. It will enhance your chance of getting pregnancy and inducing ovulation. तो बेसिकली इस गोली से ओव्यूलेशन इंड्यूस होगी. बट मैडम, मैं आपको फिर से ये सलाह दूंगी कि आप अपने डॉक्टर के ही संपर्क में रहें. वो जैसे दवाई जब आपको बताते हैं वो आपको तब खानी है. So let's once again give some short tips on breast engorgement so that those who have joined us later can also have a look at it. So breast engorgement is basically swelling, tightness and itching in the sides of the breast will increase. It usually occurs in early days of breastfeeding between day 3 and day 5. But many may even have a problem later on because of incomplete latch of the baby and incomplete emptiness of the breast. So what you can do to relieve your breast engorgement is, you can make sure, you have to make sure that your milk flow is completely done. You don't have to hold your breast once the baby has latched completely, and then you have to give some warm compression. You can hand express your breast and even use a pump. डॉक्टर से पूछने के लिए रही हूँ, टैबलेट जस्ट आपसे पूछ के जा रही हूँ. ठीक है मैडम, वेरी गुड. आप अपने डॉक्टर की सलाह फॉलो करिए. माय बेस्ट विशेस टू यू कि आप जल्दी कंसीव करें और जल्दी जल्दी खुशखबरी सुनाएं. थैंक यू सो मच. सो आई विल वाइंड अप दिस सेशन फॉर टुडे. थैंक यू माइलो.